Health coverage for COVID testing may likely end after the end of the public health emergency. Federal agencies have been producing materials to help clarify how the end of the COVID public health emergency will impact coverage and payment requirements. Currently, the U.S. Department of Health and Human Services is anticipating that COVID public health emergency to end on May 11th of 2023. Once that public health emergency is declared over, some of the provisions that come from the CARES Act and the Families First Coronavirus Response Act will also end, namely some of the coverage and payment requirements. Both of those federal laws said that health plans and issuers are not required to provide coverage for items and services related to diagnostic COVID testing if it is furnished after the end of the public health emergency. If they do provide such coverage, they can charge a copay or require a prior authorization or other medical management requirements. That is why the IRS, Department of Labor, and U.S. Department of Health and Human Services has been issuing frequently asked questions and guidance to help people understand what some of the requirements are. They're clarifying some of the rules, and they're also making recommendations. In their clarity, they did confirm, yes, that the coverage can end for some of these services after the end of the public health emergency. The recommendation is to encourage health plans and issuers to continue to provide testing without a cost share or prior authorization requirement. The departments are also encouraging plans and issuers to notify participants of key information regarding coverage of COVID testing, diagnosis, and treatment, to continue covering benefits for COVID diagnosis and treatment for telehealth and remote care services after the end of the public health emergency, and to continue to make cash price of COVID diagnostic testing available on a provider's website for a sufficient period of time after the end of the COVID public health emergency. You can read that frequently asked questions document from those federal agencies. We link to it in the description below.